Do you ever wonder how well our government programs and services are working? It's a question I'm sure many people across America have asked themselves. Well, there are experts across our federal agencies who work with data, evidence, and evaluations to ensure that our government is making data-driven and evidence-based decisions. In 2019, Congress passed the Foundations for Evidence-Based Policymaking Act, or Evidence Act. This legislation followed findings from a bipartisan 2016 congressionally created Commission of Evidence-Based Policymaking, which made 22 recommendations to Congress to improve the use of data and evidence building to inform government programs. Here's former Representative Steve Russell's brief on the committee's findings at a 2018 House Oversight Committee hearing.
The Commission's recommendations fell into 4 categories: establishing a new federal entity to facilitate data linkages, increasing access to data, modernizing privacy protections, increasing and strengthening federal evidence building capacity.
Since the Evidence Act passed, agencies have been taking these categories around evidence building to new levels. But what does evidence building really look like at the agency level? And how are these agencies working with different partners to improve how well our government functions? This is Empathy Affect, Borsmarsh Media's podcast that explores the human side of government. I'm Melissa Harris-Szynski, and today we're going to explore these very questions by examining how evidence building is being used at one very big agency, the Department of Health and Human Services. We're joined by HHS Evidence Officer Dr. Susan Jenkins, who will walk us through the journey of implementing the Evidence Act's requirements at HHS and the impact of evidence building in sharpening government efforts, like in COVID-19 policy decision-making. Let's get into it. Dr. Jenkins, thank you for joining us on Empathy Effect. How are you doing today?
I'm doing really well, and I'm excited to be here with you.
I am too. So I know that a lot of your mission work is grounded in the Foundations for Evidence-Based Policymaking Act, otherwise known as the Evidence Act. And many listeners may not know this, but you are actually really hands-on with the foundation of the legislation. So I can't think of anyone better to really explain it. So just teeing us off, can you explain what the Evidence Act is and how does it impact HHS and your partner agencies?
Absolutely. I am really excited to talk about the Evidence Act. So the Foundations for Evidence-Based Policymaking Act was passed in January of 2019, and the goal of that act is to improve the way that the federal agencies develop and use a range of different types of evidence. And by evidence, we mean information and data that turn into information that can inform programs, regulations, and policy. And so the evidence specifically includes program evaluation, which is one of my specialty areas, performance measures, which I've also worked in for a long time, foundational fact-finding, and policy analysis. And the Act builds upon previous efforts related to performance measurement and open data, making sure that the data that the government provides and produces is open for use and transparency. And it also covers the protection of confidential data and specific protections for that kind of data. And so from my position at HHS, Title I of the Evidence Act, which focuses primarily on program evaluation and lesser degrees on other types of evidence building, the requirement is for agencies to appoint an evaluation officer, and that is my role at HHS. So the Evidence Act is near and dear to my heart.
Absolutely. And, you sit in this role now as HHS's evaluation officer and have been in the position for about 1.5 years. So not too long after the Evidence Act passed. So what led you to this position, especially after spending over a decade of work leading evaluations at the Administration for Community Living?
Absolutely. I think I have a somewhat interesting path to this particular position. I've been a program evaluator for about 25 years, and program evaluation is the rigorous systematic study of how programs work how they operate, to understand how and why they are or are not successful. So looking at measures of how much a program is operating and then the degree to which it's meeting its goals and mission. And you can apply program evaluation. It's similar to policy evaluation, the evaluation of regulations and other things like that. And so working in that field, I've always tried to take opportunities to experience different methodologies, different agencies, different focus areas, and things like that. So when I was at ACL, which is an operating division in HHS, ACL being the Administration for Community Living, I was the office director for the Office of Performance and Evaluation. So we did work with performance measures and evaluation. During that time period, the Evidence Act was moving through the legislative process, hadn't been passed yet. And people were talking about it, though. There was a bipartisan commission that worked on developing the recommendations, about half of which were implemented as part of the Evidence Act. And so we were really following that closely at ACL as well as at broader HHS. And I was able to have an opportunity to go on detail, a temporary assignment to the Office of Management and Budget, who were responsible for putting out the guidance once the Evidence Act passed. And that gave me a great opportunity to understand how the Evidence Act works, what the legislation really requires of agencies. And so I was able to implement that at ACL and worked as the evaluation officer at ACL and developed many of the deliverables and set in place the processes related to the Evidence Act. But then this position opened up at the main HHS in the Office of the Secretary in one of the staffing divisions, and I couldn't resist. I really was interested to see what impact I could have and how I could share my experience and how I could grow in this position at the HHS level as opposed to just at the operating division level. So it was sad to leave ACL. I really enjoyed that position, but when this position opened up, I could not resist moving to try to attain this position.
Before the Evidence Act was enacted, Susan mentioned that there was unevenness across federal evaluation use and capacity. But once it passed and Susan moved to HHS, she observed great changes to evidence-building quality and guidance across federal agencies. The legislation also required agencies like HHS to establish evidence plans. So Susan and her team worked across the different operating divisions to create a 4-year evidence-building plan between fiscal years 2023 and 2026, as well as annual evidence plans to put the legislation to work. I'll let Susan explain how she works across an agency as big and federated as HHS to decide which evaluations to conduct.
So what we've done and what we plan to continue doing is working very closely with the operating divisions, the liaisons from across the agency, to have them help us to identify what are the most significant evidence building activities that they're engaged in and evaluations specifically for the two different reports. We also work with them to understand the capacity building needs and highlight those things that are most significant. By most significant, we let them choose that to some degree, but we give them guidelines, something that is an agency priority, a secretarial priority, an administration priority, something that may be a very large program that has a lot of public visibility. So those types of things help us to determine which things we're going to focus on in those plans. But it is very hard to pick and choose those things and to write a coherent evidence building plan or annual evaluation plan, given that there's so much different, so many different focus areas, so many different populations that are being served. The other thing that I want to comment on as a big challenge is thinking about how to do cross-agency evaluation. So within an operating division or within a program area, there may be specific grant programs or service programs or policies, but many times these build to larger initiatives. So as we think about telemedicine, as we think about the funding that came out for the COVID-19 supplemental funds, there were a lot of specific programs that were highlighted, but it was all building toward a more general goal. And so thinking about how we can do cross-agency or large-scale initiative evaluations is something that we're working on developing processes, procedures, and methods for, but that is still a very difficult task for us.
Definitely. You hit on some of the challenges too there in your response. So I want to get a little bit more into it. What do you think have been some of the greatest obstacles or challenges in meeting the requirements of the Evidence Act? I know there are lots of elements like access to high quality data, personnel and capacity needs, funding, the scope of work and how big HHS is. What are you thinking about?
Mm-hmm. And so the scope of work is one of those things, but taking a positive view on it, having so many different people and focus areas, a lot of people with the Evidence Act really are evidence-based, want to work on evidence building, want to have good, high-quality data for their programs. And so while we may have unevenness in the availability of data, the quality of data in certain areas, the staffing levels or funding levels for certain areas, and that's just natural and that happens across agencies, we have really strong people that work together, that partner together, that are building and really dedicated to building this type of evidence. And so I do think if I have to pick one thing that I find most challenging in talking with other evaluation officers, I think many of them also find challenging, is the resource to do this type of work. The Evidence Act did not come with dedicated funding, so making sure that we have enough staff to be able to collect the data, analyze the data, use the data, turn data into information for policymaking, that's difficult. Having funds to conduct some of the evidence building activities and the evaluations is also difficult in some areas. So I think resources is probably the area where I would say we have across government the biggest challenge.
That would make sense. Amid the limitations in resources, how do you find yourself overcoming these challenges? Have any partners been helpful in helping you conduct your work? What other ideas or ways are you navigating those tough waters?
Mm-hmm. We're still working to find the best ways to do it, but what has been most successful, I think, is working with the different people, and it is our partners, as you suggest, that's the greatest strength. And so we work closely with the Office of Management and Budget. They've put out a number of resources and other things. They recently came out with a federal evaluation toolkit that is really helpful for us as we work with maybe people who are not evaluators to understand how to use evaluation, when to use evaluation, how valuable evaluation can be for their programmatic decision making, for operating programs, for funding decisions, things like that. And within HHS, we have an Evidence and Evaluation Council that has liaisons from across HHS, all of the operating divisions, and many of the other staffing divisions. And the staffing divisions are ones that provide guidance and recommendations and support to the Secretary of HHS. But we have liaisons from across HHS who work with us on developing the deliverables for the Evidence Act. It would be hard to do in any one office. So we really do have a team to help us to do this. We can share information. We can highlight where strengths are, where gaps may be that we can try to fill with capacity building activities. And so those partners are entirely necessary, critical to us being able to do this work. And I also want to tip my hat to leadership at HHS. The leadership has been very supportive of increasing the use of evidence, in highlighting the importance of evidence. And so HHS leadership, the secretary and deputy secretaries are extremely important in this as well. So the people, that's what we focus on.
Speaking of the focus on people, Susan mentioned before that HHS has an Evidence and Evaluation Council, also known as the E&E Council, to help meet the deliverables of the Evidence Act. The Council has working groups to meet these requirements, like assessing the agency's capacity to build evidence.
Every 4 years, we have to assess the capacity of our agency to build strong evidence. And the first year we had a committee, and I was at ACL at that time, but I was on this particular committee of the Evidence and Evaluation Council. And we looked at various different types of measures across the agency. Some agency parts were already doing these types of assessments. We worked together to make sure that whatever we came up with was something that was doable for the staff at the agency to be able to respond to, that it wasn't too much burden. We pilot tested the capacity assessment to make sure it made sense to folks, that we would get usable data from that particular exercise. And over these last few years, and in my role as evaluation officer, we continue to use the E&E Council for this. And I will say that the working group for the capacity assessment has pushed back on us a little bit to say, we cannot do a large capacity assessment every year. My vision and my dream was every year we will do a large scale capacity assessment to look at different elements related to capacity to build evidence. Ideally, yes, that's what we would want to do, but level of burden, especially with the COVID-19 pandemic happening at the same time, there just was not the staff resource, the energy, there was no time left. People were really stretched thin. And so they pushed back on us in a good way to say, hey, why don't we do check-ins periodically and make sure we do a really good job then every 4 years doing a comprehensive, useful capacity assessment. So the evaluation E&E Council is really good at helping us to draw that line between ideally what we would like to know and realistically what can we know in a good, high quality way.
In addition to the E&E Council, Susan's division also runs a Data Council, which shouldn't be confused with HHS's Data Governance Board, which is run by HHS's Chief Data Officer. I know it can be a little confusing, but these groups work closely together to share information about the evidence-building work across HHS. The overlap and connectivity of their work has actually led to the Data Governance Board including a newer evidence-related category in its annual Data Award, an honor that celebrates individuals' and teams' efforts across HHS in delivering solutions to data challenges.
One thing that I'm really happy about with the Data Governance Board is in 2023, they started an annual data award. Because of our relationship, the Chief Data Officer and myself, they said we have 3 categories for this data award, and it was focused more on data use agreements, linkages of data, and other things that fall more squarely under the Chief Data Officer. But they said data and evidence are really important things to work on together. Do you want to have another category in this annual department-wide award related to evidence building? And so I said, absolutely. And so they allowed me to draft an award specifically related to the building and the use of evidence and tying that together. So we really work closely to tie all those things together. And it's reflected, I think, in the councils that you mentioned, and then just in our broader work together.
Yeah, and as you were talking about collaboration, it made me think about an interesting nugget about something that you do, which is that you teach a course at American University for mid to late federal staff about evaluations. So I was wondering if we could take a moment for you to share more about the course and if you see federal partners, who are tangential to or maybe outside of evaluations, or maybe even folks that you work more directly with, understanding your work and the impact it can have on improving federal programs and services.
Yes, I'm really happy to be able to have that opportunity to teach in this leadership development course at American University. And it's a leadership course, so it's for folks that are beginning their leadership journey or wanting to move into higher leadership positions in the federal government. And I believe, and I think other people believe, but I know I believe, that to be a good leader, you need to be able to assess information and data. You need to have objective, concrete, comprehensive, high quality data about your programs, your initiatives, your offices, those kinds of things to know what's working and what's not working. So you can do more of what's working use federal funds efficiently, use other federal resources effectively, and know what's not working so you can make changes in those areas. And so being able to work with these mid to late career federal staff, I'm able to impart that information to them to help them to be good consumers of evaluation. While I think everyone should be an evaluator, I'm not so high on the evaluation idea that everyone wants to be an evaluator. I understand that. But this way, give them the tools to be able to know, well, when would an evaluation be helpful? Who should I talk to about conducting an evaluation? What is a strong evaluation approach for the types of programs or offices that I run? But also, maybe evaluation isn't necessary. Maybe performance measures or a different type of evidence building will be helpful to me, and helping these folks to become more comfortable with what is evidence, how it can be useful to them, and specifically how they can use it to be better leaders in the federal government.
Yeah, thank you for sharing a little bit about that. I want to go back to HHS because there was just this March, so not too long ago, your office released HHS's fiscal year 25 evaluation plan, and it outlines 49 evaluations across 10 operating and staff divisions of HHS. Just like how we were talking about the evidence building plan that's, over 4 fiscal years, this also covers a lot of space. So I was just wondering if you could share some of the highlights from this plan for the coming year and, if there's anything that you're excited about.
Absolutely. I think folks that are interested in what types of evaluation research HHS is intending to do in fiscal 25, this is a great document for folks to look at. And we put them out every year as required under the Evidence Act. So people can go back and look at what evaluations were planned and conducted in previous years as well. And we ask, as I mentioned, for 5 significant evaluations based on the operating or staff division's own assessment of what is a significant evaluation. And we're really excited this year about how many evaluations we got, because each year, starting with 2023, then 2024, and now with the 2025 evaluation plan, which was released at the same time as the federal budget for 2025, we get more and more evaluations, higher quality evaluations. We get more enthusiasm from the evaluation liaisons. As this becomes somewhat institutionalized in the agency, we're really excited about that. And there are a range of different types of evaluations about processes for demonstration programs that may be new, for programs that may be established but haven't been evaluated in some time. And so there's such a big range of different things that are going on. So we're excited about that as well. And you may notice I am very carefully avoiding picking a favorite evaluation, because all the evaluations are my favorite evaluations. All the operating divisions are my favorite operating division. But one thing that I'm really proud of that we instituted with this evaluation plan that was new was we linked the evaluations, or we asked the people submitting the evaluation information, those liaisons, to link the evaluations to federal-wide priorities, such as the Federal Evidence Agenda on LGBTQI+ equity and the Learning Agenda in support of the President's Management Agenda. So it's not only is this evaluation giving the operating division important information for their mission, which then leads into the HHS mission, but are we also building evidence related to federal-wide initiatives? And we got a lot of good feedback from the evaluation liaisons about that. And now we have things that we can follow up with and then report back to OMB and to the administration about how HHS is building evidence not only towards our own mission, but also towards the larger administration priorities. So that was a nice addition, I think, this year to the evaluation plan.
That's really wonderful. And I know we've talked a lot of big picture here and just understanding a lot of the nature of your work. But I want to get into some of what your evaluation work looks like for the American people. So I was wondering if you could share some examples of how your efforts to integrate evaluation, data-driven decision-making, and evidence are improving HHS's programs and services for the public.
Absolutely. So I'll start generally, but then I'll get to a specific example that we're all very proud of. But having more focus on evaluation, a greater understanding of the value of evaluation, I think has had a broad impact on how programs are developed, how grant requirements are developed, the types of data that grantees and contractors and programs report back to us. So I think that that's a general win for all of us. But as part of that data award that I mentioned, with the particular focus of the evidence building award, we asked for examples of outstanding contribution to the building of evidence for policymaking. And we received 15 excellent nominations from across HHS. And the nominations were to expose people, to highlight people or teams that were championing the building or use and dissemination of evidence, enhancing the culture of evidence building at HHS, or supporting the use of data to address key programmatic or agency level questions. And so, as I said, we got 15 nominations, and one of the winners was something that we're all very, very proud of. It was the Vaccine Effectiveness and Policy Team in the Coronavirus and Other Respiratory Viruses Division. And so this particular team was at the forefront, furnishing real-world estimates of COVID-19 vaccine effectiveness to the U.S. as well as globally. And their work played a pivotal role in the rapid authorization of the COVID-19 vaccines, which was a remarkable achievement given that normally the authorization of a vaccine can take many years, but given the priority, the need, the emergency state that we were in, the pandemic, they were able to do this within a year of the pandemic's onset. They provided statistical analysis and evidence synthesis that formed a basis for data-driven COVID-19 vaccine policy decisions. And it included multiple HHS agencies. So it was also a large-scale partnership, which is amazing. And it included CDC, NIH, FDA, and through their innovative approach, it gave vaccine policymakers high-quality data that they needed in a timely way to respond to the COVID-19 pandemic and have a good, strong response to that pandemic, improving outcomes for all of us.
Yeah, I mean, a lot of what you do may seem invisible to people because it's sort of just baked into the work that the agency does at the mission level. But it's really great to hear, how it comes from like sort of one end and then out the other, and how you've saved lives and helped people through the work you do. So thank you for sharing that example. Looking forward, you're making your way through the evidence building plan for those 4 fiscal years. You have your fiscal year 25 plan. But what more do you hope to accomplish before fiscal year 26 is over? And where do you think evidence building and data-driven decision-making can get stronger for HHS and your partners in the years to come?
Absolutely. I would say we've learned a tremendous amount over these 4 years or 5 years since the Evidence Act was passed about how to actually operationalize these types of things. It's a great idea, but how do you actually make it a great outcome? And so I think we have learned a lot in those areas. And as I mentioned, partnerships, but I think communication and transparency are the big things. And that's what we will continue to do. We will continue to build an evidence building infrastructure and to build those relationships. We rely so much on folks to tell us about the evidence that they're building, but also conversely, to tell us when they're having trouble building evidence so that we can help them and support them. And over these years, something I was very proud of that happened a few months ago is one of the operating divisions that has struggled more than some of the others in terms of their evidence building and really setting up an evidence building infrastructure. They came to us, they came to me and my team to tell us that. And we can't help them, we can't support them if we don't know this. And so this let us know that we were building the trust and the relationships that we hoped that we were. So we've been working with that particular operating division to develop processes, procedures, approaches to helping them to build their evidence building capacity. So meeting them where they are, but building that relationship. A few years ago, I really don't think that they would have come to us, we're in the office of the secretary, to admit that they were struggling. So we'll continue to do those types of things, and we'll continue to partner with the other evaluation officers to learn what's working for them, what things that they may think, you don't want to do this. You can learn from our lesson that this isn't the way to do things, and continue working very closely hand in hand with the Office of Budget and Management. The evidence team there is very supportive of these efforts and very helpful to us. And they convene the Evaluation Officer Council, and they're co-chairs on the Interagency Council for Evaluation Policy. And I'm also on the steering committee of that particular council, where we can share information across the federal evaluation community to be supportive, to learn from each other and things like that. With HHS, one of the goals that we have as we close out this 4-year evidence building plan and plan for the next one, which will be 2026 to 2030, is tying much more closely with the strategic plan of the agency. The Evidence Act asks that the strategic plan of an agency and the evidence building plan be tied together. And we did as best as we could in the first 4 years, but trying to learn how to develop an evidence building plan was a lot of work in and of itself. So now that we have a little more understanding of how to do that across such a large agency, we're well positioned to work more closely with strategic planning to ask the questions of what are our strategic objectives as an agency for the next 4 years? What evidence do we need to be able to meet those objectives, to help us to know how to best meet those objectives? And what are our evidence building capacity areas in those areas that we need to focus on? So tying those more closely together, I think, will be more efficient in getting the information from across the agency, combining that information, and showing how one thing builds on the other to continue to build HHS's evaluation and evidence building culture.
Absolutely. It sounds like, partnerships, the communication, the transparency, those are all like key ingredients here. And I'm definitely hearing it across your responses. Before we wrap up, is there anything else that you want to mention that we haven't touched upon yet?
Yeah, I think as people think about evidence and evaluation, performance measures, all of those different things, it's a world that everyone can be engaged in. You don't have to be a statistician to be a friend of data, if you will. You don't have to be an analyst or to have a great background in research methods. Those things are always useful and always a good thing to have. But if you're interested in data, if you want to know how and why your program works and are willing to ask those questions and work with people that are trained to do those things, the statisticians, the researchers, things like that, and to then use those data, that's what we need. Everyone needs to be a friend of data, as I like to say. And that's what I want to communicate, that we may have specific people that are named as evaluation officers. We may have specific liaisons in HHS and other agencies that are focused on this evidence building work, but everyone should be involved and should benefit from that work. And that's what I'd like to leave us with.
Definitely. Everyone can be a friend of data.
Yes.
Susan, thank you so much for joining us on the show again. I feel like I learned so much. As someone who doesn't have a background in data, I found this conversation to be very enriching, and I hope others find it too.
Thank you so much for having me. I really appreciate the opportunity.
Thank you again, Susan, for the work that you and your colleagues do at HHS. I love the idea of being a friend of data, and I hope you can be too. If you want to learn more about the many evaluations that Susan and her partners are spearheading across HHS, we'll link to HHS's latest evaluation plan in the show notes. I hope you enjoyed this episode, and if you did, make sure to subscribe, follow, and share the show with a friend. Also, don't forget to rate us wherever you listen to podcasts. Thanks, y'all.
Empathy Effect is a product of Forrest Marsh. You can reach us at forrestmarshmedia@forrestmarsh.com with any feedback, questions, or inquiries. If you want to know more about today's guest, are interested in participating with Forest Marsh, or becoming part of our community, check out our show notes for more information.